Medication anticoagulation. What type of medications are required after Fontan surgery, and how long will the child be on them? Well, clearly you need something to thin the blood, anticoagulation. You're better with anticoagulation than without anticoagulation. There seem to be, in the mind of doctors, difficulty to decide whether warfarin or aspirin are equivalent. Most of the study would indicate that aspirin is actually enough, but that's not convincing everybody yet, and there may be some group of patients that may benefit from warfarin compared to aspirin. It's still a work in progress, and I have biased view on the topic. Undisclosed. Disclosed, I'm not sure. Then there are a lot of cocktail of medications. The doctors have used a lot of drugs that are used for heart failure, like ACE inhibitor, captopril, lisinopril, the most frequent names. What happens is that if you have heart failure, your heart does not pump enough, so if you dilate your arteries, there's more blood flowing to the body. If you have a Fontan circulation, there's not enough blood going to the heart, so the heart does not pump enough. And so the people tend to give drugs to dilate the arteries. Because the arteries in the limbs are a bit closer, tighter in a Fontan circulation. But the arteries in the body may be tighter because that's what you need if you have a Fontan circulation. And if you dilate these arteries, it has been shown that actually your exercise capacity decreases. There's no proof that these drugs have any benefits on the long term. Still, about 2/3 of the patients are on these drugs. And so the debate is out there, and we're not the only institution in Australia. It's the same in some centers in the US. So the debate is out there whether or not these medications are useful, and we're trying to do some studies. We have a current project where we want to actually seize this medication in some patients to see if it makes any change to the situation. What side effects can this medication cause? Well, the main medications that we're using are anticoagulants, so you can have bleeding, bruising easily. Aspirin, a bit less than with warfarin. Warfarin can also be responsible for having less dense bone, and so you can be prone to fracture. The antihypertensive medications have little side effects. I'm not the most specialist doctor for medications, but they can have coughing with ACE inhibitor, so it's not always well tolerated. What evidence is there that anticoagulation is required in a Fontan circulation? So that's very strong. If you have no anticoagulation, you're more at risk of adverse events. You can have more strokes, you can have more clotting into your circuit, you can have more complication, more risk of death. The literature is very clear on that. Given the new anticoagulating in the adult medical world, will these be available to pediatric patients? Well, there's currently 3 trials on what we call a NOAC, novel oral anticoagulants. And we're likely to participate to some in Australia. This drug looks a bit magical because they kind of as potent as warfarin without the side effects of having to check the level of drugs that you're taking, but that need to be tested. Some of these drugs were tested for people with valve, and people had great hope that that would be very efficient, and it turned out actually not to be efficient. So it needed really to be tested to prove its efficiency. So what do you prefer, warfarin or aspirin? So I'll just, it's a direct question, I'll just whisper it, okay? Okay, that's all. I haven't said it publicly. Post-Fontan, high pressure in the pulmonary arteries. what medications help lower pressures, and can you take them long term, or is there a time when you just have to face life with the pressures high? That's a very interesting question, and that's something where a lot of work will be done in the next 2-3 years. When you have a Fontan circulation, the flow is passive and it's not pulsatile. When you have pulsatility into the lung arteries with the heart, every heartbeat, it stretches the lung arteries, and you have a secretion of nitric oxide, which is a product that dilates the arteries. And you lose that when you have a Fontan circulation. So, when you have a Fontan circulation, your lung arteries are somewhat, not very severely so, but somewhat, as is the lung arteries are a bit tighter than they could be. And if you give drugs, nitric oxide, bosentan, sildenafil, these type of drugs, the lung arteries do dilate. These drugs can be taken for a lifetime. And there's a lot of interest from pharmaceutical industries, and there's likely, again, probably 3 trials that will be ongoing, checking the interest of this medication in the Fontan circulation. This could be of interest and change the life of the Fontan. They may improve the life of the Fontan. They do increase the exercise capacity within 6 months to a year, without much doubt, I think. The big question is that, would there be an interest to take them lifelong? There's a big interest to take them for a lifetime, mainly for the industry, because the common feature of these drugs is they're very, very expensive. And there are diseases like pulmonary hypertension where patients are taking them every day for their lifetime. And that may be the case for the Fontan population. But we'll have to prove that it's efficient. We know whether it's efficient in a matter of 6 months to a year soon. A big question is that efficient in a matter of 5 to 10 years? Do you have a better life? Do you have better chance to live longer if you take this medication for a long-term life? To answer these questions, we likely need large international registries where we will follow some patients who are taking these drugs for 5 to 10 years. That's the only way we're going to find out, and we're working on that. Is there a time when you have just a face life with a pressure heart? You and I, everybody, will have an increase in the pulmonary pressure. With age, all your arteries get stiff, and it's no different with your lung arteries. My lung arteries are getting stiffer than when I was 20, and it's going to get stiffer and stiffer. And the big unknown now is that when you reach 50, 60, 70 years old, this natural increased stiffness that you're getting into your lung arteries, how will it affect the Fontan circulation? It's a big unknown, we'll have to watch it.